Okay, fantastic. Um, so the driving force of emotions. I think as a parent, uh, it has dawned on me that parenting is extremely difficult. For me personally, it's been one of the biggest challenges of the last 9 years of my life. I have two children. And with all of the stress and with all of just the challenges of being a parent, what is oftentimes sort of the go-to is we parent our children's behaviors. We focus on our children and the behaviors that they show us, and we oftentimes miss the opportunity to really connect with and engage and really support the emotional development of our children. So tonight I want to talk to you about how we look sort of past and beyond the behaviors and how we really try and focus in and engage with our children and their emotional development. In order to do that, a couple of objectives that I'd like to try and meet this evening. The first is really to illustrate how our children and our teenagers are going through an extremely challenging, complex, difficult process of development and growth. The developmental milestones that kids as young as 6 are really starting to endure include them sort of working on making meaning of the world around them and the way in which they are internally experiencing that world. So we'll spend a few minutes tonight talking about some common or some relevant developmental milestones that different age groups of children and teenagers are going through. I'd like to introduce and sort of talk about what I have utilized in my own practice with my own children, but also in coaching parents as part of my private practice, is the Iceberg Phenomenon, with the goal to help illustrate the influence of emotions on behaviors. I also want to spend some time focusing attention primarily on your child's behaviors and how focusing solely on the behaviors can oftentimes lead to just increased conflict, frustration on the part of the child and the parent, and results in parental fatigue. And I want to introduce and describe some key strategies to sort of consider, think about, practice, and utilize in engaging your child and their emotions. So the next few slides, so on the next few slides, I've included here some relevant, but by no means all, developmental milestones and tried to sort of break them apart by age group. Again, the purpose of this is really to remind or inform parents that the experiences, the complex developmental milestones that our children are going through are really significant. They are substantial and really are sort of the driving force oftentimes of how children relate to their world around them. So for the 6 to 8-year-old, this is the beginning of their emerging concept of friendships. Their friends, their peers, whether it's classmates or other kids on the team, kids that they interact with in after-school programming, these relationships actually begin to take on meaning. And so because they begin to take on meaning, these kids are oftentimes beginning to feel what it feels like to be left out or to be picked on or bullied. The 68-year-old is also really motivated to do well, and their inability to feel successful in a moment with a challenge that they're trying to navigate or experiencing failure and criticism, it can be extremely difficult for a child to handle, and will likely impact the way that they're behaving in the moment. It's also, it should be no surprise that the 68-year-old is also very self-centered. They are very much sort of focused on themselves and their immediate sort of surrounding. And they have a hard time empathizing or understanding what others might be experiencing. They're motivated to be acknowledged, especially by parents or other adults, teachers, coaches. They're looking to be acknowledged for good behaviors. They really respond well to praise, and if they don't get it, they may become hurt or frustrated if these efforts go ignored. They are also interested in rules and developing concepts of right and wrong, good and bad. They also begin to challenge these rules. And again, this is all sort of motivated by their wanting to learn how they interact and how they fit in their world around them. The 68-year-old also has really limited skills to sort of self-manage the emerging behavioral reactions in response to new and complicated feelings that they experience. The 9 to 11-year-old, they're viewing themselves as part of the larger world. They're beginning to. They're also beginning to recognize how their behaviors can impact others and that these impacts can be both positive and negative. The 9 to 11-year-old is also placing increased importance on peer groups, fitting in, being accepted. They become more self-conscious about appearance. And as we saw sort of with the 68-year-olds, and even more so now, they're becoming increasingly vulnerable to the reactions that they get from their peers. They're also beginning to recognize that we can make mistakes, that parents and authority figures, that we're not perfect. And they like to try and, it feels like they like to try and take advantage of that in a way and challenge our authority. And this is really, it is such an, I think this point especially, it illustrates that this is a really crucial developmental milestone, but as a parent, it can be really frustrating to have your child challenge your authority. And so it I think highlights nicely the way in which as a parent, we need to sort of keep these developmental milestones in mind as we are reacting and responding to what is otherwise maybe normal child behavior. The 9 to 11-year-old, again, is becoming more and more increasingly emotionally vulnerable to feelings like embarrassment, rejection, anticipatory anxiety, and pessimism. And most of our 9 to 11-year-olds don't actually know what those mean. They just know what they feel like. And so, again, as parents or as caregivers, we have an opportunity to help support and develop the emotional intelligence in our children. We also begin to see them use and conceptualize better sort of self-soothing strategies to sort of regulate the emotions that they're feeling and the way in which those emotions are impacting their behavior. The 12 to 14-year-old, first and foremost, is starting puberty. They are also experiencing significant hormonal changes. So look out. This is, we talk about sort of the very early years, the first 2 years of a child's life as kind of the primary developmental period. This is very much the sort of secondary and the second most sort of significant period of time for their developmental milestones. And so much of that has to do with the way in which their bodies are changing, their hormones are changing. There are physiological as well as emotional upheaval kind of occurring in their life, really for sort of the first time with this degree of intensity. They're also continuing to challenge authority, and they may become increasingly argumentative and disobedient. In addition, they may reject the support or comfort of a parent. They're also beginning to experience more significant mood swings, anxieties about acceptance, fitting in, feeling normal, and preoccupation with their physical appearance. As kids get into sort of those tween years or pre-teenage years, there really is this significant shift to the importance placed on their peers. And we know that there are, I think most kids are able to have some or find and develop some positive relationships with their peers. And there is also an opportunity for a lot of conflicts and a lot of, teenage angst to start occurring as they're navigating their social environment. They're also becoming increasingly aware of threats to feeling safe and contained. They're experiencing feelings like shame and rejection, humiliation, jealousy, animosity. And again, they may have a real hard time articulating what these emotions are. They can certainly experience and feel them, but to be able to say, hey, mom and dad, I'm experiencing humiliation, that's not necessarily in their repertoire. As the adolescent gets a little bit older, in those 15 to 17-year-olds, they are beginning to develop better or utilize, I think, abstract thinking. It's one of the really sort of enjoyable milestones to sort of see a teenager begin to move beyond kind of cause and effect and really be able to take on more sophisticated style of thought. However, when they're stressed, they will oftentimes revert back to those concrete thoughts, the good and the bad, the fair and the unfair, the angry and happy. And so it is in those moments during those stress, one of the roles that parents can play is to help their teenager begin to articulate and make sense when they're stressed out of the complex emotions and feelings that they're feeling during that time. We also can certainly agree that the 15 to 17-year-old is extremely self-absorbed. They are focused on their own emerging independence, which can lead, of course, to increased conflict with family and authority figures. They also try and attempt to mask their vulnerabilities. Again, if you think about, sort of the 13 to 15-year-old is, or the 12 to 14-year-old is beginning to sort of perceive threats. The 15 to 17-year-old is now sort of developing the ability to sort of mask the vulnerabilities. They don't want others to know that they may be struggling inside. They're highly motivated to figure out where they fit in the social structure. Again, the emphasis on and the importance placed on their peer relationships, social dynamics, feeling accepted or finding a peer group that they fit in with. Extremely challenging to do and highly crucial and essential, but may leave the teenager feeling anxious and unsure of themselves, and certainly increases that internal distress that they feel on a regular basis. They're also showing increased curiosity and experimentation with sex, drugs, friend groups, risk-taking behaviors, and all of these things, these sort of the taking risks and operating outside of what has been their sort of comfort zone can lead to increased emotional vulnerability and complex feelings. So much of childhood and adolescent development is really centered on making meaning of their world around them. And if we think about that, if we think about what it would be like to all of a sudden have to exist in a very new situation or a novel environment, it's obviously going to bring up a significant amount of anxiety in ourselves and distressed emotional states. And so we, as parents and as caregivers, we do have the opportunity to sort of help guide our children through that process. We can become educators to help our children make connections between certain events that happen, the emotional experiences that they have in response, and the way that they sort of project those emotions via their behavior. Children and teens often lack sufficient processing skills. emotional intelligence, verbal sophistication to adequately explain their experiences. Often the only way for them to really sort of project what's going on for them inside is through their behaviors. Their acting out or volatile behaviors are rooted in the emotional experiences that they feel, that they endure, while they're trying to also process an overwhelm of new information related to social cues, norms and rules, peer dynamics, and the emerging self-concept, as well as for our adolescents, puberty and hormones. I want to just take a quick minute and check to see if there are any questions. There is below a feature that would allow, it's I believe a Q&A button should be there available. If you do have any questions throughout this presentation, please take a moment to jot it down. I will periodically check to see if there is, and if so, I will do my best to answer them. So I want to talk now about the iceberg phenomenon. I learned about the iceberg phenomenon a number of years ago in a training that I was doing, that I was involved in and participating in around managing crisis behaviors. And I've used it both in my professional and in my personal life as a really solid representation of what is happening for our children. And as parents, what is happening as we respond to our children. So the iceberg phenomenon really it's fairly simple. It's fairly straightforward. And what it really is to try and help us understand that the tip of the iceberg, or the iceberg that we can see above the surface of the water, are the behaviors that we see in our children. They are observable behaviors. They are what we see in the moment. They are the tantrum in Target. They are the younger sibling hitting the older sibling. They are the teenager slamming the door and offering some choice and colorful words to inform us of what we can do. They are essentially, they are sort of the broadcast. And as parents, I think we too often are responding to or trying to navigate around the tip of the iceberg. It's what we can see. It's what potentially threatens our sense of parental obligation or parental values. But when we focus solely on the behaviors, what we are missing is the entirety of the iceberg below the surface of the water. And I like to think of that the rest of that iceberg, what we cannot see, as the emotions, as our child's emotions. These emotions can be hidden, but they do serve as sort of the base and the root sort of cause of the behaviors that we can indeed see. As parents, we witness and respond to the behaviors of our children all the time, but we cannot simply rely on their behaviors to inform us what specifically is going on for them. Nor can we ignore the fact that there are these significant, substantial, and important emotions that are occurring below the surface of the water. As a parent, as parents, we have either learned or adapted or incorporated a number of different parental responses to our child and teens' behaviors. We use strategies like planned ignoring, redirecting, setting limits, threatening or giving consequences. We take things away. We reward behavior. We have, I think, often been sort of coached or encouraged to really focus on the behaviors of our child. We parent to the behaviors, but again, we are potentially sort of missing the substantial driving force of the emotions that are at the root of the behaviors that we are able to respond to. The consequence that this can have on a child or a teenager potentially leaves them feeling very alone and distressed with these new, emerging, complex feelings, and frustrated, misunderstood, vilified, or invalidated if those feelings are ignored. So if we respond to just the behaviors and the child is experiencing a tremendous amount of emotional distress for some reason, just because we respond to the behavior doesn't mean that the emotional stress gets processed. It doesn't necessarily get dealt with. It doesn't necessarily get named. And so we really are when we see these behaviors, we really have an opportunity to engage with the child's and their emotions in a way that helps them develop not only the feeling of safety that these emotions are okay to have, but also some language or some understanding about what these emotions are and where they come from. We use the term emotional intelligence quite frequently in the field. And it really is true that if we can help our children, or if you can help a child develop some meaning and some understanding and some language, you are going to, over time, see the behaviors decrease with the hope that their ability to express those emotions become more common. Sorry, minor technical. So I put together two scenarios. And I'll take a minute just to sort of read through them. And then, we'll look at sort of the iceberg phenomenon through the lens of these two scenarios. So Daniel, age 8, and his sister Andrea, age 10, are playing catch outside while their father is raking leaves. This may or may not have happened to me recently. Daniel is struggling to get the ball to his sister accurately, and his sister begins to complain about his brother's throws. As Andrea's criticisms and verbal frustration grows, Daniel throws the ball over the fence, yells at his sister, runs inside the house. Daniel's father immediately follows him inside, reprimands him, and sends him to his room as a consequence for ruining the game and calling your sister names. He tells Daniel that he will have to apologize to his sister before he is able to come off his timeout. Daniel begins to cry and becomes visibly escalated, as though he's about to throw a full-on tantrum. Now, in this situation, Daniel's father is responding to the behavior, as I think is a common occurrence for most parents. In scenario 2, Maya comes home from school and is irritable. She flings her backpack on the floor, stomps around the house, and is fixated on her phone, despite her mother asking her how her day was. As Maya continues to storm about the house, her mother asks, "What's wrong?" To which Maya replies, "Nothing," rolling her eyes and sounding annoyed. Maya's mother redirects Maya for her attitude, and Maya raises her voice and exclaims, "Just leave me alone," before slamming the door to the bedroom. Maya's mother, concerned with Maya's disrespect, knocks on her door while beginning to lecture her loudly through about house rules and respect, and demanding that she open the door. Maya, of course, ignores her. Now, both of these situations, both of these scenarios are ones that we as parents will likely face at one point or another. And again, when we think about sort of all that we have to do to manage as parents, it is no wonder that it becomes quite easy to respond to the behavior. Again, it's observable, it's right there in front of our face, and oftentimes it challenges our rules or our norms or our values. And so there is this instinctive reaction that we have to parent to the behaviors, while again, missing the opportunity to engage with our child's emotions. So back to and sort of illustrating scenario 1 with Daniel using the iceberg. So again, the behaviors that we see, throwing the ball defiantly, name calling, withdrawing and retreating into the house, crying and tantruming, all of those things are what Daniel's father in that scenario has responded to. Now, there's nothing wrong with responding to that. You certainly have to have limits. You have to have rules. You have to have norms that are enforced. And you really want to raise a child who is able to respect norms, values, rules, sort of in the duration of their life. But if we only focus on the tip of the iceberg in this scenario, we miss the fact that Daniel, 8 years old, is experiencing anger. He's feeling hurt, resentful, inept, frustrated, sad, rejected, vilified, ashamed. All of these emotional experiences are common for someone his age in this scenario that we described. His older sister is becoming more and more and increasingly, frustrated with him, which is really activating this sort of internal distress that he's feeling. Unable to name it, unable to sort of, rebut his sister, he does what he knows how to do, which is to externalize that internal experience in the way that is described in that scenario. For scenario 2, very similar. The behaviors that we see, the tip of the iceberg, is Maya throwing her backpack, stomping, fixated on her phone, disrespectful attitude, eye rolling, demanding to be left alone, slamming doors, isolating, ignoring, so on and so forth. Sounds very much like a typical day in the adolescent experience. What is also typical is what Maya is experiencing from an emotional perspective. Now, we don't know what happened before Maya got home from school, but based on her behaviors, we can make some assumptions that she may be feeling anxious or distressed, distracted, overwhelmed, helpless, misunderstood. And as a parent, and in this situation, her mom, is responding to Maya about the rules and about respect and about wanting to know how her day was. Maya, in contrast, is again experiencing that fairly significant emotional distress. So if we focus too much on behaviors and we don't give sufficient or significant time and space to explore or understand or help children make meaning of the emotions that they're experiencing, we lose an opportunity to help develop the child's emotional intelligence and validate their emotional experience. Focusing initially on connecting with and acknowledging the child's emotions will help the child regulate and give them the opportunity to develop language to describe their emotional experience. And the hope is that they are able to replicate that learning and incorporate that in the next situation that occurs. They are able to maybe access the language or access their understanding or the way in which they connect with their emotions. And they are more likely to express themselves verbally, ask for help, or give validation to their own emotions, rather than just relying on the behavioral explosion or the behavioral output, which as parents we are gravitating towards responding to. But once a child feels heard, once they feel supported and sort of understood, they become more receptive to talking about their behaviors. They want us to know what is going on for them, but they are going to make us work for it. They're going to be more likely to engage in a discussion about how to appropriately deal with these feelings when they come up and repair any ruptures necessary due to their behaviors. And at the end of the day, our goal is to help our children learn. It is not to set rules that they have to follow. It is not to impart our values onto them. We are, as parents, I believe that we are enthused by the opportunities to help our children develop a better understanding of the world that is around them. So we get to talk a little bit about some strategies to do that. Before we dive into that, I'm going to check. So we do have a question that is really geared towards strategies and responses working with children who have maybe more of an explosive disposition and or maybe experiencing sensory issues, which probably further compound the developmental milestones. It gets trickier, of course, and more challenging when there are complications or inherent challenges, whether it's related to cognitive development, neurological development, or mental health issues. Using these strategies is still effective, but engaging in them in the moment can be a lot more challenging because of the intensity of those behaviors. As well as the sort of the anxiety that they activate within the parent. So it is, what I would sort of recommend or suggest is, as a parent or as a caregiver, how do you utilize your supports in a way that allows you to sort of access strategies that are more effective, while also trying to manage the intensity of your own emotional reactions when you see a child who is struggling. So in regards to those strategies and strategies to engage with your child's emotions, as I was sort of creating this presentation, I was able to come up with this acronym of REVIEW. And the reason why I like it is because it really does speak to, as parents, what our role can be if we are responding to our child's emotions and not just responding to their behaviors. When we review something, whether it's new learning or we review something for, we review our notes for an exam, we are going back and trying to reinforce the learning. And so I do think that, as a significant part of our job as parents is to help our children learn about the world around them, I like this idea, this concept of review, because it speaks directly to the mechanism in which we can help our children with that learning. So the acronym, and we will go through sort of each point here in a little bit more detail. But the acronym is RELAX, emotion reflection, validate, investigate, emotional empathy, and work out what's next. It is so important as a parent that we are, to the best of our ability, managing our own emotional reactions to the stress of raising children. Oftentimes when we see or are responding to behavior, and I know this has certainly been true for me, I do so in a way to try and eliminate the behavior as quickly as possible, especially when the behavior is sort of done in public, or when the behavior involves, an issue around sort of bullying or teasing. I know as a parent, my knee-jerk reaction is knock it off, stop with the stern look and the stern parent look, and hoping that will be sufficient in addressing the behavior. Unfortunately, it's oftentimes not, which leads us feeling sort of more frustrated or more anxious or more exasperated by our child's behavior. As we get increasingly upset, frustrated, or anxious, which we all do as parents, it's a completely normal response and reaction. It makes our ability to teach less effective. Our own feelings of anger and stress can inhibit the way in which we speak, or the time, the way in which we speak to our child, the amount of patience that we feel. So first things first, to the best of your ability, take a breath. Check in with yourself. How am I feeling right now? If I'm feeling really, really anxious, is now the appropriate time to try and respond to and engage in this process of honing in on my child's emotions, it might be challenging. So what can we do in that minute to sort of bring our own our own response down, or manageable? One way in which we can do it is utilize that image of the iceberg. Visualizing, using visualization or visualizing the iceberg can really help as just a brief but important kind of check that behaviors are driven by emotions. And when we can remember that, it may help to provide some context around, is this sort of normal behavior? Is this a normal response to a situation? Again, and normal being relative to the developmental milestones that our children are going through at that time. Speak calmly, be patient, find compassion. Our children, even when they are frustrating us, even when it feels like they are provoking us, even when it feels like they cannot do a single thing sort of on their own, and I'm needing to get their third glass of milk for them, even in those moments, if we can keep in mind that our goal is to help them learn, to help them feel safe and supported so that learning can happen, bring that compassion to the conversation in engaging with the child's emotions. Emotional reflection. Now, this can be a little bit challenging or a little bit complex. And I say that because we are not, I think, geared towards responding to the emotion. We are sort of programmed to respond to the behavior. But as we are observing our child, whether it's throwing the tantrum on the floor or on the other end of the door, shouting for us to go away, if we can identify or acknowledge the emotional state that they're experiencing, we are now beginning to engage in a conversation or in a process that might be more tolerable for the child to participate in. So very straightforward and direct statements. You're really angry. You feel like this is so unfair. You're overwhelmed and want to be left alone. You're feeling scared. Anything that allows us to sort of put a spotlight, if you will, on what we think is the emotional experience, and we are reflecting back to the child what they are saying and what they are showing. We also don't have to be an expert on what their emotions are. It is okay for us to take an educated guess. We will be corrected by our child and teen, most likely. And when they do so, it's really important because it goes a long way in being able to use the language that they're using. So, for example, if we think back to scenario 2, where Maya is sort of ignoring mom and came home and was frustrated and was kind of throwing her stuff around. As mom tries to engage with her and Maya sort of begins to respond with her attitude and some rudeness and disrespect, rather than focusing on the disrespect and the rudeness, right? Use that information to help inform making an educated guess about what Maya might be experiencing in that moment. So saying, you're feeling really overwhelmed and you want to be left alone. Well, if overwhelmed isn't the sort of the emotional experience in that moment that Maya is having, but rather she's just so annoyed with her friends Susan and Hannah and says, no, I'm annoyed at Susan and Hannah because they ditched me to go to Hannah's house. Remember to use the language that Maya, that the child has used and sort of restate the emotional reflection. Oh, you're feeling really annoyed at your friends because they ditched you. I will say is, as we sort of go through these different strategies, the emotional reflection really is one of the most challenging strategies to sort of learn and incorporate. And like a lot of things, when we are trying to practice or implement a strategy in the moment, it's oftentimes results in sort of a disaster. I do encourage you to uh, practice. Practice on a partner or on a spouse, or practice when your child is actually experiencing positive emotions and showing positive behavior. If it's, you know, your child who has scored a goal and is sort of running around the field really, really excited, reflect that emotion. You are feeling extremely excited. You're feeling really accomplished. If we can practice this emotional reflection strategy, we are more likely to be able to access and utilize it when things are a little bit more stressful for everyone in the moment. I think the important part of validating is really showing our child that their emotional experience is tolerable, that we can offer them reassurance that what they're experiencing internally is actually quite normal and appropriate, even if the behavior isn't. When we're trying to validate our child, we really do want to stay focused on the emotions. We don't want to sort of validate the emotion and then immediately criticize the behavior, because the second that we do that, that a validation piece sort of gets lost. So again, and we're trying to incorporating kind of the two scenarios that we talked about. Mom's response to Maya is, of course you're so annoyed with Susan and Hannah. It can feel so embarrassing to feel ditched by your friends. Again, in this scenario, mom isn't necessarily responding to the behavior, but she's trying to sort of express to Maya that it is okay to feel really annoyed, and that it's also okay to feel really embarrassed or ashamed or angry. You were already angry with your friends, and you were frustrated when you thought I didn't understand. Another key part of validation is when, as parents, we can reflect back on our own misjudgments, if you will, or our own sort of immediate kind of response to try and solve the problem for our child. When we can acknowledge that, or acknowledge that our child or our teenager is going to have emotional reactions and responses to us, we again reinforce that message that those feelings are okay. Now, this isn't excusing the behavior. It is simply creating a sense of safety that complex emotions are things that are not necessary to be afraid of, or to withdraw from, or retreat from, or ignore, but rather that they are a part of the human condition. These last two validating responses are in response to Daniel, with dad saying something along the lines of, your sister was being really mean to you. It makes sense that you're so angry with her. And even that notion of, you know, Daniel potentially feeling really frustrated and angry that dad is going to require him to apologize to his mean old sister before he comes off of his timeout, which likely further exacerbated that sort of the tantruming kind of behavior. Dad has an opportunity to again acknowledge that it's okay for you as a child to have an emotional reaction and response to me as your parent. You felt like I was being really unfair. I don't blame you for being frustrated. It's not enough necessarily to just sort of validate or acknowledge the emotions. Now, there are some instances in which it is, but when you have the opportunity or the safe, or the space, and the sort of the feeling of safety, it can be a really awesome opportunity to work with your child to really investigate for the benefit of your child's learning. Investigate the situation. You process with your child the connections between the events that occurred, the emotions and the feelings that resulted, and the behaviors or choices the child made in order to deal with those feelings. And it's okay, right, if your child doesn't necessarily have the language to express, Dad, Mom, I was really frustrated, or I felt really left out, and that made me feel really sad. If they're not able to sort of access the language, or they don't have the words to sort of describe the feelings, part of that investigation can really focus on how are they experiencing those feelings in their body. Is it, do they feel really tense? Did it make it, were they unable to hear anything else that was going on? They were so just fixated on their anger. So again, we want to sort of encourage a conversation about the emotions. You spend time trying to get sort of the whole story, but from the child's perspective. Now, it is very likely that a parent and a child will look at sort of the same incident that occurred and have two very unique perspectives. That being said, we're really interested in trying to get the perspective of the child, because we want the child to be able to talk about what they're experiencing within a context that they understand. It is also the case that if we are trying to convince them of our perspective, or that our perspective is more accurate than what they experience, we are simply opening up the door for conflict to occur, and we are really trying to avoid that during this time. And we are also trying to avoid making any kind of judgments about the child's behavioral responses, but we do want to try and encourage them to think of different strategies that they could use in the future to help them verbalize and work through their emotions. Emotional empathy. It's never too early or never too late to try and cultivate empathy in your children. When engaging with your child's emotional self, we really want to try and help them build emotional empathy, the awareness of what others might be experiencing, or how others might have experienced a certain or a similar situation, whether it's their peers or whether it's adults or whether it's people that they don't know. We can help encourage our children to be able to sort of recognize emotions in others. And that really is the sort of driving or foundation of empathy. Is can I acknowledge and engage in empathy, or understand the emotion that another person is going through. We can personalize this in a way and really help our child make some sort of meaning out of it as we share maybe our own experiences with similar emotions to what your child was experiencing. This can be especially helpful to reassure the child that their emotions are normal and appropriate. Imagine talking to your child about when you were young and how you managed or dealt with the first day at a new school, and what were the emotions that were going on. Or if there was a medical appointment, you had to get a flu shot, and you remember the stress and the anxiety and the fear that you experienced. Or when someone else has done something that felt very unjust. If we can talk to our children about, hey, I remember when, and this is how I felt about it, we are not only communicating and reinforcing emotional empathy in our children, but we are also drawing connections and establishing for the child, oh, it's okay, others have felt this way as well. So again, reassuring the child that their emotional experiences are normal or appropriate given their age and the situations that they've been in. We also want to sort of wrap up and conclude this sort of intervention, if you will, these strategies with sort of work out what's next. And these conversations that occur, they can be as quick as, a couple of minutes. This is not a sort of long drawn out process. And so as parents, we can, sort of begin to wrap up the conversation. This is probably one of the sort of first times in this process where we want to maybe start thinking about if consequences or certain repairs might be appropriate given the child's behavior. But in order to do so, it can be really empowering to try and invite the child's input, asking them what do they need in order to move forward. Do they need some time and space away from other people? Do they need kind of an opportunity to, do they need a distraction? Do they need to spend a few, additional minutes doing something with mom or dad that will help them, sort of reestablish that sense of sort of safety that they feel with parents. We also want to invite them to sort of think about and talk about and offer how they can take responsibility for their behaviors. Do they need to apologize? Do they need to sort of fix something? Do they need some additional sort of time away from other activities and sort of be on a timeout for 5 minutes or so? Oftentimes when we give children the opportunity to sort of talk about it and give their input, they are really responsive to it, especially if we've gone through this sort of process of engaging with them about their emotions. And we've shown to them a willingness and sort of a motivation to help them learn. They are oftentimes willing to sort of take accountability for their own behaviors and may suggest, I know that I need to go apologize to my sister for what I said. Or maybe I need a little bit more time just reading in my room and doing kind of a quiet activity. Our kids are quite capable of being able to sort of articulate what it is that they need. And if they're feeling calm and they're feeling connected to us as a parent, they're more than likely going to give us a sense of what they think would be helpful for them to kind of get back on track. It's important to remember that the goal of engaging with your child's emotions is to help them make meaning out of their internal experiences and the way that they behave. If you have the sense, right, it's the goal is really around learning. It's not around sort of identifying the appropriate or the right punishment so that the behavior never happens again. We are, as parents, going to be more successful in eliminating or reducing behaviors that we don't want to see if we are working with our child to increase their emotional intelligence, give them skills that are more positive and more effective, and worried sort of less so about kind of the consequences that we are imposing on them. And the 5 or 10 minutes that this conversation or that utilizing these strategies may take in working out with our child is oftentimes enough to get them to a place where they're feeling calm, they're feeling a little bit more regulated, and they may very well be able to sort of kind of get right back into whatever the activity is that they were doing, or to be able to kind of have the time and the space to themselves if they would like it. It is, of course, a really wonderful opportunity to express and communicate sort of unconditional love to your child. It is not easy for them to sort of have this conversation. It's not necessarily easy for them to be vulnerable as they discuss their emotions. So when they participate in this process with us, when we as parents sort of feel that engagement and feel that connection with them, it's really important to give some positive reinforcement to that. It's really important to give them the kudos that they deserve for engaging in that process with us. And a few things just to sort of keep in mind as we wrap up this conversation. The review strategies should serve as a guide to address a response to your child's behaviors in a thoughtful and emotionally engaged manner. But even if we're not able to use in the moment all 6 of these strategies, using some of them will communicate to your child your intention to listen, your willingness to sort of understand, and your encouragement for their emotional growth. So even using 1 or 2 or 3 of these strategies, it can be of benefit to our child, especially if we are not solely focusing and responding and reacting to their behavior. Your child, especially your teenager, may question if, they might question you if you begin to all of a sudden take a different approach or have a different response to their behavior. That's okay. It likely means that you're actually utilizing these strategies effectively, or at least trying to. We are certainly, teenagers and children, they have come to expect certain responses from us. And when we begin to change those responses or find more effective tools and strategies to respond to their behavior and engage with their emotions, it's likely going to, they are likely going to notice, and they may very well point out. Again, if they do, use that as a sort of encouragement that you're on the right track to implementing these strategies. I also want to say, the content in this presentation is really meant as sort of an overview in an otherwise extremely complicated landscape of child emotional development, and implementing these strategies described. It's going to require potentially some additional support, some resources. It is not something that just because we've spoken about this for an hour, you'll now turn around and become an expert in emotionally engaging with your child. However, it is really intended to be sort of a guide on how we can better or more effectively engage with our child for the purpose of developing their sense of emotional intelligence. I also, of course, want to encourage that if your child or your teenager is experiencing significant distress or sort of more challenges beyond kind of the developmental milestones that they're trying to navigate, that might make these strategies, of course, more difficult to implement. And in that case, it may very well be useful to consult with a mental health provider. More intensive intervention may be necessary to address concerns about safety and/or dangerous behaviors. So I want to just take this moment to thank you again so much for listening to me for the last hour. I also want to bring to your attention some upcoming Ben Speaks events and programs. We do have a series of additional webinars that are coming up. Cece Duchette is going to be speaking on December 17th. She'll be having or facilitating a conversation regarding wireless technology and wireless technology safety and its impact on physical and mental health. We also have Pam Formosa from BrainFit Academy, who will be speaking about brain balancing and emotional well-being. We are working on the logistics of when to schedule that. It will likely be in January or February of 2021. We are also going to be beginning our Survive to Thrive sibling support group, which I am really excited to be collaborating with Judy Giovangelo and benefiting from the support of additional boards, Ben Speaks Board of Directors who will be helping to start that program. It is a 10-week group. We are going to be hosting it virtually. It will be beginning in January. And it is a 10-week group for siblings ages 9 to 13 years old of children or teenagers who are struggling with mental health issues in the home. So if you have a child or know of a child who's 9 to 13 years old and they have an older or a younger sibling who's experiencing developmental or psychological issues or challenges, mental health challenges, what we have found is a lot of the resources and attentions will oftentimes go to that individual, and the sibling may experience sort of their own sense of isolation or kind of concern about sort of where they fit in with the family. So we are going to be starting this group for those siblings. and we'll be starting that group on January 14th. For more information and to register, you can go to the Ben Speaks website. We will also be making this PowerPoint presentation as well as the video available on the Ben Speaks website, which is benspeaks.org. And if you have any additional questions or feedback or comments about this presentation, I am certainly open to and would encourage and would love sort of feedback, including your thoughts. I would be, and you can certainly email me on at the email at the bottom of this slide. Just want to check in if there's any. So we do. We are just about out of time here, and it doesn't look like we have any questions that haven't been answered. Oops. So we will wrap this up. Thank you again so much for participating this evening. As a parent myself, I can certainly appreciate and understand the time that it takes, taking out of your schedule to participate in this. I certainly hope it has been helpful, and I wish you all well. Stay safe and take care. Bye-bye.